This is Fort Portal Regional Referral Hospital in Uganda. It serves over 3.2 million people in the Rwenzori region. It runs an active COVID treatment center. During the second wave of the pandemic, Buhinga, as it is locally known, required 3 times more oxygen supply than ever before, from 100 cylinders to over 300 cylinders a day.
So many of these patients will come with a very low oxygen saturation and sorely needed oxygen. We had to deploy staff to work 24 hours to match the production capacity to be able to supply the patients here, and will also supply for other facilities in the region. But this continued to overwhelm the plant. Eventually, the production capacity of this plant started reducing. Actually, at one point, it is shut down.
At the core of a raging pandemic, with very little or no preparations to scale up, the demand for oxygen goes up, health facilities struggle to keep patients afloat, and in dire times, lives are lost.
It was a depressing moment because we could have at least an average of 1 death per day in the months of June and July, with a lot of challenges, which included oxygen supply, oxygen cylinders, the oxygen heads themselves, the oxygen delivery devices, the masks were not adequate at that moment, given the number of cases that were flowing in.
Part of Uganda's oxygen supply problem is the low production and delivery capacity. The manufacturing plants can't match the demand in the face of a pandemic, leading to a crisis. However, lives need to be saved.
Currently, if we experience low supply, we get to Kampala, the industrial area, Namambe, which is very, very expensive. Because what you bring, 60 cylinders, 70 cylinders, wouldn't last also for a long time. Yet you have to go back, and the transportation and so on, they have been very expensive.
To improve quality of oxygen delivery in this region, UNICEF, supported by the U.S. Bureau of Population, Refugees and Migration, partnered with the Ministry of Health and national medical stores to save lives during the crisis. This was done through the facilitation of movement and distribution of oxygen across the country.
Actually, as of now, we do receive filled cylinders from national medical stores to increase on the capacity and reduce on our travels to Kampala to fetch oxygen from there. In every epidemic control, there has to be a lot of coordination and collaboration, and also international response to a pandemic makes countries to contain it faster. So if we did not have this collaboration and coordinated efforts, response efforts with all stakeholders, including agencies and partners, then I think we will have taken a longer time to reduce the infection rate and also to reduce the mortality rates of this pandemic. And the support provided by UNICEF has really made the operations in IPC and also the clinical care of the patients a little bit easier for the hospital during this period.